More reasons to immunize. Talk to your child's doctor or go to cdc.gov/vaccines.
Time flies. Let's immunize.
At the KSMO Studios, 1340. It's time for us to get together with Hospital Administrator Kasey Lucas, and he's made it in. And any problem getting in, sir?
No, it was good. I mean, I had to clear off the car this morning.
Well, yeah, everybody had to do that, yeah.
You know, other than that.
Besides that, no big deal.
No big deal. Just got to take care. Be careful. Take it
yeah.
slow.
Yeah. Well, the snow's coming to. It will be coming to an end here in the next, let's say, hour.
Yeah.
Probably.
Yeah.
And maybe parts of eastern Dane County, maybe 10:30. But it's going to continue to pull and move. It's 29 degrees already, which means won't take much for the salt and things to work on the pavement. So very good. All right. Well, we have a lot to talk about, so we may as well get to it and hit it right on. We had a board of directors meeting Tuesday, but also we had an audit report with BK&D, and it's the same auditors the Salem Hospital has used for how many years has that been? What, 15, 20?
Yeah.
Long time.
Yeah, it's been a long time.
Long time.
Yeah.
Anyway, these guys come out of Springfield. They do a tremendous job for our hospital, and we want to first off tip our cap to them because they really explain things very well, and the board really appreciates that. I know they do, because a lot of them are not accountants, and they would sit there and just go, "What?"
Yes. Yeah. No. They do a good job of taking each. They have their talking points and their bullet points they want to point out. They do a good job of explaining those and what that actually means for the hospital. So
right, very good. Well, anyway, the good news is that the hospital got an unmodified opinion, which is as high as they go.
Yes,
they've kind of changed the terms to that since I was in school when they used to.
They
like to change things around. Just us old guys don't remember it. But in the meantime, though, an unmodified opinion means it's as good as it gets. They don't have to change anything, and when you have that kind of opinion, and it's not relying on anything else, it's not a what am I trying to say? Contingent opinion, which is contingent on you correcting things.
Yes.
Things are already there, which is good. So very good. Nice part is the hospital had a very, very, very good year. 2 years in a row now. The hospital's had good years. Kasey, let's talk a little bit about why that's important. The hospital underwent some major changes. We all know that. Basically almost 5 years ago is when those changes started to be implemented. And in the last 2 years, even more changes have been implemented, which have changed things around. Because basically what was happening is that the hospital had to make some changes to survive.
Yes. Well, and, you can go back to changes of physicians, physician turnover, just employing physicians in general has been a change for the healthcare industry and really hospitals. For the longest time, we would recruit physicians to the area, and then we would, and to entice them, we would say, hey, we're going to help you with your expenses for the first 3 years, and then agree for an additional 3 years for you to stay in the community, and we would forgive those that debt, whatever that was, and then you'd have a physician that had spent 6 years here building a practice, making those connections with the community, and that's what drove really that physician to stay in town and to stay. And, and they had a lot of investment into that, and it's changed. The whole industry's changed to basically employing physicians, and so when you employ a physician, a lot of the time they can, at the end of my 3 years, I can pick up and leave because I didn't invest any of my personal dollars into this practice, and it's just, it's not. I say that not to blame or to.
It's not an excuse.
No, it is just the way it is,
Sure.
and so we've had to deal with that, and and still hopefully keep those physicians around, bring them in, make the environment an environment that they want to stay in and they want to work in and they want to be part of. So,
when you look at a hospital like Salem Hospital, you're more than just a physician. And I think, having had to go to a hospital yesterday for my father, you see these physicians and they are employed by the hospital, and that's about as far as it gets. I mean, they see so many people that there's no way that
Yes.
they can create a personal relationship. Grant you, they're very professional yesterday, and we were at Mercy yesterday.
Yes.
Okay, in St.
Okay.
Louis. Very professional, very nice people. But if I went there in a week, they would not know who I was.
Right.
That's the difference. So now you actually get interpersonal relationships with people because you not only know them, you'll know their family, you're going to know their friends. A small town, that's how things work. Larger towns like that where you're coming in for maybe one time in 20 years.
Yes.
Might have only happened one time. You're not going to remember those people. So that's a big difference in the Salem Hospital. But also getting up to, one of the other things the Salem Hospital had to do is get up to date. That started back when Mr. Pryor was still administrator. We had to start looking at X-ray. The X-ray room for a long time was pretty antiquated.
Yes.
We started moving that forward. Phone systems had to be moved forward. Different things had to start moving forward. And Kasey, that's something that can't happen overnight because the hospital doesn't have those kind of funds.
Sure. That is exactly right.
One step at a time.
One step at a time.
And so when that transition became, and of course then also they were going in electronic medical records when when you came back and when you got back into the hospital. The neat thing about the electronic medical records is that was updating the hospital at the same time. You could see a future reimbursement on that because they were going to pay you back. But my gosh, I remember you losing your hair over all that. but there was a lot of strenuous times because what system do you use? How's it going to work with this system? We're not going to say computers were in their infancy, but definitely hospital electronic medical records was.
Yes.
And trying to get it all to work together. I mean, there were many meetings that your timeline that had been set, a 3-year timeline, got altered.
Sure.
Quite a few times.
Sure.
And it wasn't your fault.
No.
It's just that one company's software didn't work with the other company's software, or this hardware didn't jive with and needed to do something different. It was trial and error, wasn't it?
Yes, definitely. And we started out with we've had Evident, the software we have today in the hospital, the hospital software. We've had that since, I'm going to say 94. So 94, we bought the package that all of your ancillary services like radiology and all those things, and the financial package, which has all of the accounting software, all of the payroll and all of that combined in 94, and then eventually in 97 went with the nursing program and pulled that point of care program into it.
Okay.
And piece by piece we would add things to it. But it came to about 2010, 2011. We started the process actually before I came back in 2010. They had already went through the process of looking, okay, the Evident, the company that we use, did not have a very good ER solution. So we had to have something else in the ER. And so we found that already all of that review and all of that comparisons happened prior to me coming on. And then as I came on, they were right in the middle of the implementation of that service. And so that went, the implementation went well, and the software itself is very friendly, and some of those physicians will say, hey, yeah, I still like that software is very good. Same thing happened in the clinic. We saw that they had this clinic solution, but it wasn't
optimal.
They had not, the base that this was, I guess, created out of was an old system. So when you're starting with an old system and trying to bring it to
today's
standards,
it
just didn't work. It didn't work.
Okay.
So, and again, we had that system for a little bit. We probably stumbled around with it for a couple of years, and then we eventually went away from it and said, no, we're going to get another program in the clinic. Went with all scripts. And now today, after probably, I'm going to say 7 years with having 3 different systems in the hospital, we see the need is changing to, hey, okay, we need to consolidate. We need them all to be one because it's not seamless. That communication from one to the other is not seamless today.
Right.
And it's not as useful. I mean, when we talk about meaningful use and the reason for all of these things.
And the communication between departments.
Sure.
Yeah.
It's just not where it needs to be. And so earlier, about 4 weeks ago, the board, the med staff, administration met. We talked about some objectives that we have. One of those 5 objectives is taking the EHR and consolidating that. And so we're going to start the process of going through and looking at what other software is out there. Do we stick with the software we have? Do we change? And what's involved, the costs involved, the time commitment that's involved with all of that.
Yeah.
I mean, that is, it's
a big
easy
consideration.
It's easy to say, yes, we want something new, we want something different, and that's a better solution. And everything has its advantages and disadvantages, and so all those systems, I will say the service, the customer service that we get from our current vendor is fabulous. Yeah, it is awesome. And so you kind of look at that too, and that's what you deal with on a daily basis. I mean, that's the touch points that you have to worry about from them. That are they going to be treating me well? Right. Are they not? And we've had issues with others. So again, you start looking at those, and that will be something that we probably over the next year we hopefully sort through and get a good idea of where we're going and what direction it's going to go.
And that's why when we're saying it takes a long time, these decisions and they're expensive decisions. When you finally implement them, are taken with time and care. When you especially right now, when you start making these major decisions. And everybody has to get on board. That's the hardest part. And everybody's going to have their favorite. They're going to say, hey, I really like that old stuff. Don't change.
Yes.
I'm used to it. Well, it's easier to do something you're used to doing. But, if you don't have that, you have to learn. Usually when you implement a system, though, then you got to work out the bugs. And that's always something to think about. But, what we're saying is, though, all the different things the hospital has gone through over the last 5 years, and now the last 2 years, they've finally seen that turnaround that they had anticipated, that they really felt was going to happen.
Yes.
I mean, you don't know that at the time you're doing it, but to get where you needed to go, you had to make those changes, and so those changes were made.
Yes.
When I look back on it now, I mean, look at the different things that have happened. The expansion of rehab, my goodness gracious, that's getting huge. Home health continues to grow. Different things of that nature. And, of course, then the changes that Medicare and Medicaid throw at the hospital, like, oh, by the way, we're making a change here or making a change there.
Sure.
That you have to adapt to. So
yes.
all these different things that happen, and our hospitals continue to grow, and actually in the last 2 years, and according to what we're seeing with the numbers, has done a very good job of pricing and being competitive, yet being still one of the lowest priced hospitals around.
Yes. But
yet maintaining a competitive pricing, doing a better job with your contracts with insurance companies and getting better reimbursement. And in case if anybody would ever say, well, they're making their money off their insurance companies. Well, in the nice little pie graph here that they showed up, 6% of what the hospital is paid is from commercial insurance companies. Yeah. That is not a lot.
No.
To have a big profit.
No.
So, so the contracts you work out with them and what they will pay, what they won't pay, you make your adjustments to your billing, and if your patients get taken care of. And that's what it's all about. And so there's a lot of things that go on behind the scene, and we could probably talk about for 2 hours. That would really bore people to death. But, but what we want to say is this. Hospitals made the needed changes to move forward in the right direction, and with that, your cash investment position increased again, $280,000 over the previous fiscal year. The patient service revenue is up 9%.
9%, yeah.
Okay, tell me another hospital that's up 9%.
Well, that doesn't happen. And I think that goes to a lot of our employees, a lot of the services we've put into place.
It does.
Yeah.
But also the pricing and things of that nature.
Sure.
And being current with your billing.
Yes.
Also being right on top of different things.
Yes.
So being a little bit more in tune with what's going on. So very good. Operating income, which is not the tax dollars, just the operating income.
Yes.
improved 129,000 to 437,000. Now that's 129,000 better than the year before.
Yes.
437,000 is good. There's a lot of things our hospital has to do yet. We know that. And so when you start thinking about $437,000, you think, man, they are making it. Mm-hmm. That new roof that you may have to put on, what's that, about $1 million? If you had to replace that whole roof,
thing, about $500,000 to $600,000.
Okay,
yeah.
600. Well, there it goes.
Yeah,
437.
Yeah,
it has to be done. And that was one of the things that I really appreciated them pointing out in BK&D, and I hope the board did.
Yes.
Is that those dollars that you're making here, you've got to put back in plant and equipment.
Yes.
Very important, which is what the hospital has been doing, and
yes.
that's kind of what we've been saying.
Yes.
But they reminded everybody, you've got an aging facility.
Yes.
You've got to put that money back in and get it up to date.
I mean,
and so
they're saying now is the time.
Now is the time.
Yeah,
so you're making the money.
Yeah.
Now is the time. Very good. So you've got a significant Medicare, Medicaid activity, which they then also had some good news about Medicare. Maybe next February, getting a nice bonus.
Yeah, being underpaid all year and getting $700,000 back from Medicare.
And that'll be a nice boost in the income. But,
yes.
But at the same time, that is from the previous year. So what you're billing this year won't be reflected in that.
Right.
So
very
good. But again, a lot of the activity. Very, very, very important that what we do. And I did mention that the Medicaid electronic incentive that we were talking about being reimbursed, that's about ready to end.
Yes.
So you won't be getting any money back on that.
No, a small amount for that. And we did talk about disproportionate share. So Missouri dollars that we get from the state of Missouri that help cover those uninsured, uncompensated care that we provide.
Right.
And that over, I go back, 5-6 years, there are amounts that we owe them for about 6 years worth. Mm-hmm. Now this year, they said we don't owe them anything for this year because the way they calculate it, we were right on with what they had paid us.
Very good.
So, but over the years, we've accumulated this $525,000 debt. Now, they are talking about because today on the interim, as we go throughout the year, we're paid a per diem amount for our inpatient Medicaid and other things, and then a flat percentage for other. Now they're looking at taking all of those ways that we're getting paid and rebasing that. So those dollars are going to change. Whether today they're going to go up for us or down, I'm going to guess down for us, but that will impact us too. So those are things to keep in mind, and that $525,000, hopefully with this rebasing, they may take that into consideration with that, and then look at setting up that rebasing ever so often instead of letting it go for years and years and years.
Yeah.
I can remember 5-6 years ago them talking about rebasing that Medicaid payment.
Still hadn't
happened. So we'll just have to see on that.
There's probably just not one real answer to how to do that.
No.
And that's why they're trying to probably find the best answer, but who knows how long that will take. Reconciliation of the net income, outstanding when you start looking at it. Things, of course, they're very impressed with the donation of a new mammography machine.
Yep.
And made a few little changes on that. If some of that could need to be depreciated out, not expensed out. And so basically that was the big one. And we were kind of talking about the reconciliation of accrued FICA that you and I kind of talked a little bit about, but that which doesn't normally happen, but there was reasons for it.
Sure.
Yeah.
Sure.
So those things do happen. Current assets continue to grow, which is good. I always like assets growing, and of course they also tell you to look at watch the next fiscal year and where it's going to go.
Yes.
Always keeping the cash up hand. The cash did increase $126,000 from 17 to 18, but the accounts receivable more than triple the cash amount that you're getting. So there's that. Watch that. You just want to watch the accounts receivable. You can get a high amount of accounts receivable, Kasey, that we know the hospital does not get reimbursed all that money.
Yes.
A lot of that gets written off.
Yes. And the longer it stays in that accounts receivable, the less likely that the percentage that we're going to get of that goes down.
Right.
So, and that's what they came in and looked at that. And really, that has a lot to do with our days in accounts receivable and how long we're keeping that debt. So,
which is still, though, is good.
Sure. When you look at the benchmarks, for critical access hospitals in Missouri, the average is around 56, 57, and we are at 45, which is, again, it's a good thing, and we want to see that continue. And as we get to October, we've got some of our revenue cycle, which is part of that driving that AR down.
Right.
Part of that revenue cycle is at a standstill today, or we're short-handed at some of that, and that really affects us. So you'll see some of those days in AR and cash on hand change over from this time period to October. So we'll see a little bit change there, but.
Let's see. Yeah. So, again, a super solid balance sheet.
Yes.
Current assets are up, and, of course, the non-current cash and investments, they've continued to rise. But as we mentioned earlier, that warning about property and equipment, because it did reduce $98,000, and that's where she was saying, guys, can't let that happen.
Yeah.
1 year, maybe two.
Yeah.
But after that, you need to be pumping money back into that, which the hospital has.
Yes.
But you've got other things that you need to get done, and you know that.
Yes.
I mean, it's already on the list to be done. If it's just it has not happened yet, and not reflected in those numbers.
Yes. Yeah.
Days cash on hand, and they were just amazed at that. Still, over 90. For the Salem Hospital, that's not normal.
No.
Not normal. When you start looking at critical access hospitals, and they were down about 57. And we're at 92, 93 at the end of the fiscal year. That's just not normal. Salem 2 years ago was at 58.
Yes.
Which is about, and that time the norm was about 78.
Yeah.
How things have changed.
Yes. Just opposite. But and like I said, with those days cash or days in AR, and as those lengthen, and as that cash coming in is interrupted some, that days cash on hand goes down.
Right.
Days in AR go up, and we see a little bit of that happening. Again, I feel like we're at the at the bottom of that. We're going to be climbing back up, so those days cash on hand will be coming back up, and those days in AR will be dropping off.
Well, and as you mentioned, you're shorthanded. You contracted some coders to come in and get that out. That billing has to go out for you to get paid. If it doesn't go out, and you've got the expenses, that doesn't change.
No.
If you don't get the billing out, you can't get paid.
Yes.
And that becomes, and it doesn't sound like much. Somebody said, well, what if it don't get out for 14 days? Well, you're already into another month by the time you get paid. So if you're looking at a 45 to 50 day turnaround, if you bill it out in September, say September 18th, you won't see it until November.
Yeah.
No, let's just be honest. It's just not going to get there any quicker than that. And taking a real quick look at the total liabilities against the net assets. Again, we're still always amazed that our long-term debt is as low as it is at $386,000. Hospitals just don't have that. You look at where I was over at Mercy, and that's like $4 billion. That's unbelievable, But of course, you look at the spread of that campus, you can see why. But against the net assets, you start looking at that 5.1 ratio. That's unbelievable when you have that long-term debt to capitalization. 5.1. And we really never had it bad here. I can't remember the last time it was 10%.
No.
But 5.1?
Yeah, that's
almost unbelievable. So, very good.
And they did say, if you guys are going to do something, this is the time. You can borrow. You can do what you need to do.
Right.
So.
And with all the positive cash flow, too, that you've had,
it
makes it really easy. Very good. And there's still ways of doing that and pay very little interest. Your statement of operations, again, to show the solid balance sheets that have been coming forward. And the income statement shows good numbers all the way through. And everything that they were talking about, including the changes that have been made at the hospital, from the salary increases, supply costs that are going up, They talked about the 340B program, how important that really is, because that's about $1.3 million of your other operating revenue, which will be a major loss if the hospital doesn't get that. It can really change this whole situation around.
Yes.
But as of right now, nothing's happening in the 340B program. But these are the things that having these auditors come in, Kasey, and that's why we're bringing this out. They bring this to light to the board of directors. It's all roses right now, but you know what? One little swipe of a pen can change it for the hospital.
That is true.
That's just not fair.
I know. And it makes, the 340B program is, it is a pharmaceutical-based program where, those pharmaceuticals become more affordable, something that we can offer in the contract pharmacies that we have throughout the community.
Right.
And, you look at that and you say, but the other half of that, yes, you get this pharmaceuticals, but it allows, in the breaks that we get with those expenses, it allows us to keep and really continue to provide that emergency care that's uncompensated. Right. I mean, you look at that and say, well, that revenue, that net revenue, when it was all said and done, was $1.4 million, and you look at our bottom line, and from operations, you're looking at $437,000. I mean, that's another $1 million that we'd be down if we didn't have that program today.
Absolutely.
And so, you really start looking at that, and it's not just a program. I mean, we've talked to hospitals across the state of Missouri that it's allowed people to build a cancer center that, again, life-saving services are being rendered and offered, and it's just incredible how much those dollars go back into the services that we provide.
Reinvested.
Sure.
Just reinvested back into the hospital. And so it's a great program. But again, auditors do what they have to do. They warn you that that's where that money's coming from. Some change to that program could affect your bottom line.
Yes.
Your net operating margin, which comes from your net operations, which is just operating dollars. Salem was sitting at just around 2%, right at that, which for critical access hospitals are normally at about minus 2%.
Yes.
They live and die off their tax dollars to provide them the opportunity to get above that. That's where a total margin for a critical access hospital would be about 0.5%, where Salem's climbs from 2 to 4.2.
Yes.
Again, that's higher than your normal rural Missouri hospital average and critical access hospital. So whatever they're doing, you're doing right, and that's what they're trying to say. Just keep doing it. And then, of course, the statement of cash flows. The cash is being used wisely, and that's about the biggest compliment that you can give when they start talking about it. Because the cash, we always talk about cash, but we go right back to the accounts receivable. Can't do anything without the cash. But the net cash provided, like used in investing activities, $28,000. Didn't use a lot of cash last year, but you were given a mammography machine for $320.
Sure. Yep.
You didn't have to use it.
Yes.
So you didn't do it. The net cash provided by non-capital financing activities at $501,000. Down a little bit from 2017, but again, didn't need it.
Yeah.
Everything that has been done has really been done well planned out and thought out so far. So that's the good news. The only bad news is that you still have things to replace.
Yes.
You still have money to invest back into the plant, which will affect your cash flow in the future.
Yes. Yeah.
And that's the way it is.
That's just the way it is.
Yeah, I see sunshine, Kasey.
All right.
All right, Bill. About that, huh? Anyway, so again, the audit committee letter that they sent out, which is basically their opinion of where you stand financially. They've had in years past to do a number of journal entries and corrections. Had very few to do this time.
Yes.
Had very, you're always going to get the segregation of duties and controls. I don't even know why they even put that back in there. And I thought I thought about AICPA should really look into that for anybody that has under 200 employees or 50 employees in an accounting office. Take
Sure.
that out.
Yes.
That doesn't even make any sense.
Yes.
They put that in there, and people say, well, yeah, we got nobody checking it. The hospital would have to have 3 people in accounts payable,
Yes.
3 people to review every single check, 3 people to do every account payable,
Yep.
3 people to enter invoices, just to comply with what they
Yes.
want. You'd have to hire at least 12 to 15 different people for everything that came through the office, and all they're doing is looking at it, going through, and they're saying, yep, that's legitimate.
Yep. Checks and balances, internal controls. It's all about the.
There's
the
no
way-
way you can afford that. Well, if you did have to do that, the cost of service would go up dramatically to cover that cost. So I will often say that should be something that just put on a bullet point out on the back page on the notes saying, as per AICPA, it does not comply, but they do not have enough employees in those positions, and it's not needed in these positions.
Yeah.
There are still internal controls.
Yes.
It's just
yes.
not to their standard.
Yeah.
But really, when I look at the deficiencies, the accounts receivable, which you've already talked about, is just a big deficiency. And that's not even a deficiency. It's just that got to keep an eye on it.
Yep.
And then the inventory, talked about inventory. That has been being worked on. Your
Yes,
inventory.
we've already got
addressed
policies
that.
in place
That was
address
changed.
That. Yep.
Right. And then the documentation for restricted contributions and pledges, something that they asked, Chris Ficklin asked if they had a template for, which they do.
Yes.
And they will get that to the hospital. It's not something that you're normally getting a mammography machine.
Yeah.
It
Yeah.
doesn't happen very often.
No.
But when it does, they do need to have the proper documentation. So overall, everything very, very well done. Kasey, I'm not going to go through all the industry updates that they did because
No.
they do, again, tell you about the risks and things of that nature. We kind of addressed a couple. But overall, I thought Gene and Nyberg, the partner who was in presenting this, and Jessica, very knowledgeable in this field. We're very impressed with the hospital's
Yes.
changes that have been made,
Yes.
and very impressed with the solidity of the balance sheet and income statement, which it's a tip of the cap. She mentioned it's not one person, not
No.
2, not 4.
No, but Monica Stogsdale,
Right,
the
right.
chief financial officer, does an amazing job of getting all this, pulling all this information together,
Right.
and she will even say, there's many people that contribute not only to the actual audit,
Right.
but the cost report calculation and all the information. A lot of that is volumes and time studies and things like that we have to, throughout the hospital, throughout the year, keep those things. And then at the end of the year, we all pile all that together and hand that over, and they go through it with a fine-tooth comb, and they
Good.
usually come back
Yeah.
with questions and other things. And
Good
so-
term, pile. That's
Yeah, I
exact-
know.
Yeah. Now you've been in that position. You know you
Oh,
had that job.
sure,
You know
sure.
all about it. And it's one that's constant flux because you're the one that has to be in charge. When they start changing reimbursement rates, you better know about it.
Yes.
And then you better make sure, hey, we need to make an adjustment.
Yes.
Those kind of things. You sit there and say, oh, I got this letter. They implemented this 3 months ago.
No. Yeah. No, those changes have to be real
Like
time.
3 minutes ago.
Yeah.
That's what you really need to do because they don't give you the option of saying, oh, I didn't know about it.
Yeah.
Too bad.
Yeah.
Too bad. All right, very good. So let's talk. So the audit report was outstanding, and again, we want to thank not only Monica but everybody. I think that the front office does a tremendous job, and
Yes.
again, the communication between departments, getting all this information together, and it definitely is a team effort. So it's working, and I like what they said. Whatever you're doing, keep doing it.
Yep. Yeah.
Whatever changes you made, stay on that track because whatever you're doing is working. Very good. Speaking of working, it was a very working month.
Yes.
In the month of October for our Salem Memorial District Hospital. If you would like to say a busy month, you're understating it. It was extraordinarily busy. And Kasey, when you start looking at these admissions and the acute care, that's the highest I can remember.
Yes.
Did you guys?
Yeah.
Anybody have
Yeah.
a chance to look if that's a record?
I believe Monica said she went back 10 years.
Yeah, 10
and
years.
So,
I didn't know if that was.
yeah.
But I remember one time we had a flu epidemic, and I know there were quite a few in there, but I don't think it was as many as we're showing here. But anyway, before we jump into all that, there was a presentation by Ashley Sullins of Home Health, providing a lot of detail about what Home Health does and getting just a real quick update on basically an April through September period, which, again, our Home Health has always been good.
Yes.
It's been a long time. I love the graphs and stuff. You know, it's always hear somebody talk. You know, they get these ratings. If you give us a 10, it's great. If you give us a 9, it's still okay. But if you give us an 8, it takes that 10 and makes it under 9. And I'm like, yeah, I can see that. And then people are like, how would you do it if you balance it out? Because it's going to lower every 9. It's going to bring the 9s down.
Yeah.
So you really don't want to do that. But it does happen. Somebody's going to give you an 8, and then it's just going to be that way. But it's not just Salem Hospital that gets those. It's everybody.
Sure.
But when you talk about the overall rating of care, Salem at 87%, everybody gave them a real good, nice improvement. State of Missouri is 91%, but Salem's gotten awards for this in the past.
Yes.
You can't get better than when you got the awards. And so when you say performance improvement, how do you do that?
Right.
So I think that's kind of a, I don't want to say misnomer, mistitled. Maybe it probably should be changed a little bit about that, because the overall rating of care is still extraordinarily high, and we're going to find that out in a minute.
Sure.
But when you already get an extraordinarily level of care, a high level of care, to make it better, how do you judge that? That's kind of likelihood of recommending 83%, which is right there on the national average. You talk about the care of patients. Salem is right there again, 86%. Performance improvement, again, timeliness of admission. Salem is right there, the national average. Everything is right on track. And then the high risk is Salem Hospital on rehospitalizations, which is at 18.3, a little bit higher than everybody else, but that's probably going to happen because of the age of
that is correct.
People. We have
that is correct.
A much higher age bracket. And then urgent care, the ER visited but not hospitalized, is 19.6%, which again, I think I go back to the age of our patients. Now, the admission by referral service, I was kind of impressed at 72% from other.
Yeah. I mean, and that speaks to that relationship with other facilities, and we've spoke to other facilities, and a lot of them they look for that home health agency that is in that area. So if we have patients that are in St. Louis, Springfield, a lot of those social workers, when they're starting to discharge and get things together, they look and say, where's the closest facility? And if we usually get the call, and they get options. They don't just give one; they give options. So, but yeah, I'm very happy to see that too.
Well, see, and I'm going to take that and I'm going to jump forward just a little bit, because why you get referred by other services is when I start looking at the star ratings and the patient satisfaction.
Yes.
All right, so you look at, they had a breakdown of 8 different home care agencies in our area, from Madera, Pyramid, BJC, Phelps Counties, Regional Medical Centers, Kindred at Home, and the TLC Home Care. All right, star ratings, pretty much the same. I mean, not a big difference there, but pretty much the same. 3.5 for Salem. The highest is a 4 you can get there, but 3.5, pretty good. But when it came to patient satisfaction, who's at the top?
We are.
Salem is. Home Health of the Ozarks also got a 5, but 2 that got star ratings, Kindred at Home, actually had a lower patient satisfaction, though their star rating was higher because of the services they offer. But it doesn't mean that they give good patient care.
Right.
Just overall means they have more services. Yeah. So that is, when I look at those numbers and I say, okay, I see that number, and then I go back to other, I see why it's other.
Right. Yeah. It is.
Because they see that number, they say, wait a minute, these guys, whatever they're doing it right.
The combination of star rating and patient satisfaction, we are, out of those 8, we are the top.
The best. Yep.
So.
That's pretty amazing.
It is.
But as I mentioned, though, home health has gotten awards before, and we've often mentioned, and I remember not slight Ashley at all, but I said, once you hit the top, you can't go anywhere but down. And we were there. Well, I think we had awards 3 years in a row.
Yes.
And they even told us at the time, you can't win it again. There's no way you can improve over that again. So don't be shocked next year when you don't get it. 'Cause the top 3 home health agencies in Missouri, Salem was in that for 3 straight years.
Yeah.
But they don't. They need. I don't want to say they don't want somebody to win again. I don't think that's the point I'm trying to make. I think it's just that you can't keep getting better, and that's what I was saying about these other things. When you hit the top, how do you get improvement? I don't know. What else can we do? Butter their toast, I guess. Whatever. But it was an outstanding report by Ashley, and the dollar figures show that too. $386,000 in revenues, and $129,000 is the excess of revenues over expenses. Yeah. And that, and we got to tip our cap to her. Yeah. But again, 2 registered nurses and 1 LPN full time, and of course Ashley herself. Oh yeah. It's a lot of work.
Oh yeah.
Home health is a lot of work.
And like I said, when you have one of those employees out, she has to step in and make up the difference, and she does. She's very dedicated and very much appreciated.
Right, and she mentioned the implementation of Oasis D, a new Medicare update that they will have to do, and so her paperwork preparation will continue, no doubt about that. But again, a tip of the cap to our home health, and still being the top, and you can just tell by the numbers, as you mentioned, star rating and with the patient satisfaction, the top one in our area for home health.
And I will say that across the board, CMS, regulatory reporting and other things, it's just becoming where you have to add staff to just comply with some of that reporting. And, if I'm going to add staff, I want to add staff for the patient care aspect of it. And that, that's one thing that we go twice a year to Washington, and we're saying, hey, can we ease some of the regulatory reporting that has to be done, because, small rural hospitals are having to do those things too. And we don't have a staff of 20.
Well, that's what we were talking about before with the segregation of duties.
You just don't have that.
You don't have it, and you can't afford it. No. Otherwise, the cost of patient care will go skyrocketing. Yeah. And just what you're talking about, if you're going to put a staff member on there, you want that to help the patients. That's a paperwork deal. Yeah. And you can't hire one person to cover 5 departments because the paperwork's different in every department. So it's a catch-22. To give better patient care, you got to have the paperwork, but in order to do the paperwork, you got to take somebody away from patient care. Doesn't make a lot of sense, does it?
No.
Yeah. But anyway, Ashley does a tremendous job keeping that up, and I thank all the people in home health. They have done a tremendous job for years. If you need home health, let me tell you, and I've talked to these people a lot. I've talked to people who've been on home health here. You won't find it better in Salem. SMDH has I want to say the best, if not the best in the state, one of the top 10 in the state.
Yeah. Well, thank you. I think we do too.
I think you do, and it's never changed. I mean, it's just stayed at that high level. You can understand where if you peak and you go down, and like we live on our laurels. We were great. We're still great. How many sports teams you see that? We're great. We're still great. And they win one World Series and they never win another one. But you're great. I want more money because I'm great. Okay, that's not the way it works. So, but again, very good job by Ashley presenting that. Let's get back to what we were talking about, a little bit about the month of October.
Yes.
119 patient admissions.
Yes.
11.5 patients per day. That's taxing on our hospital. 11.5 patients per day. Yes. That means an increase in personnel. Yes. That means an increase in, obviously, census days at 356. Last year in October, we had 162. That's almost 200 census days more. Swing bed was busy. Observation was busy. Med surge was busy.
Yeah.
Busy. We're not talking just a little bit over. 217 in med surge versus 113 the previous year. That's 104 more census days.
Yep.
That's busy.
That is busy
for a small hospital. And when you take a look at the numbers, it's just pretty amazing. Acute care percent of occupancy was 45.9%, virtually half.
Yes. Yes.
The month of October.
Yeah.
That's a lot.
Yeah. That is, And it's not so much if you had 11.5, or let's just say 12 patients a day. It's not so much having the 12 patients a day. It's those days where you have 18 to 19
patients. Yeah.
Those are the days that, and it's very important that everybody know that. Those are the days that we staff a certain level of nurses and aides, and especially on acute care. That's where a lot of that busyness and running over or close to capacity. When you have X amount, can we pull in a nurse if we need to? Sure. And we do. Just last weekend there was a need for that, and so you look at some of those. But the thing is when those patients are coming to the ER like that, the ER is that volume, and that the time that they spend in the ER may be longer than the patients that they come in and again at the time think it's an emergency, but don't, and so you see everything in the hospital. So turnaround time in the ER kind of goes up, and so those things happen.
But the more severe cases, you have to understand that.
Sure.
And a lot of times when we talk about with the hospital cases, we always mention that don't look at 1 day or 1 month and think that that's something. But in this case, when it comes to acute care, you get an average of 11.5. But when you get an average 11.5, like you're saying, you may have days you have 4. You may have days you have 18. The thing is with 18, that really, really puts a lot of pressure on those people. And give credit where credit's due. They do a tremendous job in taking care of that. Not that you don't get a lot of attention when there's 4. You get a whole bunch of attention. But, at 18, you've got people scurrying to get from one bed to another and taking care of these patients. So, give credit where credit's due. That's when you sometimes have to look at those day-by-day numbers. If you look at October and look at day-by-day, it would make a difference. You'd sit there and say, well, I had 3 in that day and 5 in that day and 6 in this day. But then you had 16, 18, 17. And you don't know what each day is going to bring. It's not going to be consistent. So, anyway, real good job on that. Busy month in acute care.
Yes.
And that means it's busy everywhere else. It seems like acute care kind of bleeds over, and a term and word was used there intentionally, into the hospital to where lab tests go up, radiological procedures go up, your rehab treatments from previous people who've been released already, but they need rehab, that goes up, and your cardiac pulmonary was out of sight in October.
It is. It drives everything. Everything goes up.
Big time. 341 home health visits. That's a lot.
Yeah.
And I hope people understand when we talk about home health, that's people going to your home. And the Salem Memorial District Hospital District is huge.
Yes, is huge.
All of Dent County and parts of Reynolds and Texas and Shannon County and Iron County and Crawford County. It's in all of them. A little bit of everywhere.
Yeah.
I mean, if you think about it, if you had to come to Salem from SMDH, that's like a vacation, 5 minutes. A lot of times you're having to go down near Echo Bluff and out toward Bunker and up toward Sligo. Those are 45 to 50 minutes just to get there.
Just one way. Yeah.
And we've talked about before, sometimes home health means seeing 2 patients. One patient in the morning, one patient on the east side, one patient on the west side.
Yep.
In one day.
Yeah.
And that's all you can get.
Yeah.
Because it's so far away.
Now, there is scheduling that they try to do.
I know, and I talked to Ashley about that, and she does say we do try and schedule it to where that if somebody's on the east side, they see all those east side patients. Yes. But there's times that can't be done.
Yes.
And she said yes, and it does happen that, somebody's over in the Bunker area in the morning, and they have to go all the way out to near Lake Spring in the afternoon. Just no way around it.
Yeah.
And so you've got an hour plus travel time just to get out there.
Yeah.
Because it's not like they're in Bunker. They're on a back road somewhere down in the logwoods.
Right.
Yep. But it's what they have to do, and they do a great job. Emergency room actually did not have as many people coming through. 808 in October versus 837 last October, and a lot less. Well, I say a lot less, 40 less than budgeted. But of those patients that came in, Kasey, a lot of them were admitted.
Yes. Yeah.
So that means they're pretty sick when they get to the ER.
That's exactly
and
right.
hopefully that number's down because people are taking advantage of the clinic and going there.
Yes.
Hopefully.
And we have seen an uptick in clinic visits.
How come we don't get a report on the clinic?
You need to put that in here. We don't.
I wondered that last, since you guys took over,
Yeah.
I really haven't seen any reports on the clinic except for the patient satisfaction. That's
Yes.
the only thing we
Sure.
get.
Yeah, that's something we need to put in here.
Another great idea by Stan.
Wow.
Well, you guys should pay me more money. We should.
It's in the report. It's just not in the stat. It's in our report. It's just
Is it
not
in your report?
Yeah.
Oh,
I mean, not here, but we have a statistical report, and it's in that statistical report.
The
We
board
just don't-
gets those,
yeah.
right?
Yeah, and this doesn't have all of our statistics in it either,
Right.
but it's got a good amount. So.
Well, yeah,
Yeah.
if you broke down every statistic, the little pages you gave would be about 45, 50 pages
Yeah.
long,
Yeah.
minimum. Anyway, let's take a look at the income for the hospital. Obviously, you had a big month. The hospital inpatient was way up. Outpatient was way up, which also means that you should have a gain from operations, which you do, but also means your expenses go way up because you have to bring in more people.
Sure.
So still
Yeah.
173,000 gain from operations, 174 excess of revenues. Big month for the month of October. That's normally a so-so month. October, I was going to say, it might be a profit month, could be a loss month, but it's usually not a big one.
No.
It's not an area usually of sickness, and well, it was this year.
Mm-hmm.
Yeah, big time.
Yeah.
All right, very good. Expenses all kept very much in line, considering the budget. It was really almost right on budget, just a little bit higher, but over last year, obviously, with more people being sick, some of those expenses went up. Supplies continues to be one of those things, and I know a lot of that's drug cost and things of that nature has gone up since last year, but supplies have also gone up lately as well.
Yeah.
Just trying to stay up to date on supplies. Utilities were way down, though. I like that. That was good for the month. That's always good.
Yes.
And Kasey and I talked about some physician contracts. Now the hospital has hired some physicians. That's gone down.
Yeah, moved to salaries.
Right.
So, yeah.
But other contractual services went up, and he and I had a conversation about that. Most of that was the coders you were saying that were brought
we've got
in.
some
We had
coding.
contracted.
Yeah, coding stuff that we have got. And we are looking business office as well. There's I was talking about that revenue cycle, and it's all that back end revenue cycle. Again, the patients come in, we've registered, we've provided the service. It's getting those bills out the door that are very important, and so we're looking at that too as well. So that's not in here yet. So
nope. But again, that's one of those things that is needed to be done.
Yes.
You got to find the right solution.
Yes.
Sometimes it's a person, sometimes it's a service.
Yes. And until you find that right person, you've got to have the service.
You got to have the service. Otherwise, you'll fall way behind,
Yes.
and then those bills don't go out the door, and then the people you've currently got employed are trying to do triple work.
Yes.
And you make mistakes.
Sure.
And when you make mistakes, what happens? You don't get paid.
That's exactly right. And we're in the middle of that. We've lost some people. We're in the middle of getting those services up and running and consistent. And so we see a lot of things. Days in AR, cash decrease, days in AR increase. So we'll see that. And we see that as we start looking at the balance sheet. But cash down from where we were last year, about $1 million. And again, we know we have that receivable of $700,000 out there too, so that makes sense. But there is some timing with those other services, the billing and the coding and some of those things that have to happen. And as a result, we see that the days in accounts receivable also go up, and you see our net receivables have went up about $863,000. So again, that's a tricky thing. You want to make sure that we get those bills as quick as we can out the door.
Right. And just to say, when you talk about training, coding is not one of those things that you walk in the door and say, okay, so you're here to do coding. Well, here's your book. And the book is like 7,000 pages long with 64,000 codes. And you have to code every single entry from the medical bill handed in.
Yes.
If you ever get a medical bill, and you'll see every single thing has a code. If you have a cut on your right forefinger that you got in the kitchen, that's what it will be listed as. It used to just be a cut on a finger.
Yes.
Now it's a cut right forefinger in the kitchen with a sharp utensil, probably a knife or a Vegematic or whatever it was. I don't know if they have Vegematic in there, but the coding has gotten so refined, Kasey, that is not something somebody can be trained on in a week.
No.
That is a long-term training.
Yeah.
It takes a long time. So that's another reason why sometimes you got to contract that out. You can't train somebody quickly on that. They have to go through a long period of time and then be accurate with their coding.
Sure.
Otherwise, we don't get paid.
No.
Or the question comes back, they throw it back at you and say, I don't think this is right. Fix it.
Yeah. But there's a delay
Oh,
there.
sure.
And, with delays, there come costs.
Yeah.
So,
They don't get paid the first time. That means they can't do another coding, so they have to fix that coding. Don't want to make, everybody's going to make errors, but you just don't want to make many of them if you can get away with it. As Kasey was mentioning about the balance sheet, again, the balance sheet absolutely solid. Salem's still very, very solid with the long-term liabilities, just not many there. Your total assets over current liabilities is still a 10-to-1 ratio. Really? 10-to-1? Come on. When people take a look at that, anybody knows accounting, 2-to-1 current ratio is usually, that's kind of acceptable. 3-to-1 is very good. 4-to-1 is kind of crazy. And then 10-to-1?
yeah.
Pretty impressive.
It's good.
Very impressive. Cash flow statements, again, show we spent a little bit more cash than we took in. But as we mentioned, we've already been discussing why that's happening. And then the aging of accounts receivables actually went up a couple of days, but still a lot of that still in the current and 31 to 60 days, which is good. That's good.
Yes.
So it's right around the corner. That money is available. But accounts receivable continues to rise.
Yeah.
So
that's the one thing we want to keep our eye on, and again, put those services in place until we get those employees in place.
Right.
So
very good. All right, very good. And let's say days cash on hand right now, 65. We do expect that to rise again. As we mentioned, we were at 92 when they did the audit. And so we've gone down a few in the last couple of months. All right, CDs. Yeah, okay.
Yes. Yeah, there's not much.
Not much there. Quality improvement program still working on the transition of care and patient safety. Debbie Hines updated the board on that. That's still that's a work in process right now, and it involves a lot of different departments, and so they're trying to pull all that together, get that communication in there so that it works the best.
Sure. Improve those things if we can, and I'm sure we can. There's room for improvement there, and so we'll do that. I did want to mention she reported long-term care and the success of long-term care. So a couple of different things. We had a survey that we'd had in October, had handed in the plan of correction. That plan of correction has been accepted. Yep. But also, when you go out to the Long-Term Care Nursing Home Compare website, you will see that Salem Hospital is a 5-star. It's as high as you can be. 5-star has a 5-star rating, and the only 5-star rating in a 100-mile radius of Salem. So then you go out to 200-mile radius, and we're one of 2 5-star rated long-term care or nursing homes.
200 miles.
200 miles.
That's St. Louis, Columbia, Springfield, not quite Kansas City.
That's what we were told.
200 miles.
And you can go out on Nursing Home Compare and look at that. That is incredible. So they do a fantastic job.
I didn't know that.
Yeah.
That's boy, oh boy.
Yes.
That's another little feather in the cap, isn't it?
Sure.
Anyway, but our long-term care, we do very good. They have very good job.
Those employees back there treat it's like family. You go back there.
Let's go back to this letter of correction. This was a minor.
Oh, sure.
I mean, very minor violation. Wasn't much to make a letter of correction, but what you have to do has to be approved by the state.
Sure.
So until you have that, it still shows up as a deficiency until they approve it.
Yep.
Which I think, didn't they already corrected it before they got it?
Yeah, we had the plan before they left, they knew.
I thought
they
Debbie
knew
said we already put the plan in action,
Yeah.
already had it done.
Yeah.
Because they kind of said, yeah, that'll work, and just go ahead and
Yep.
submit the plan. So, anyway, very good. Hospital Auxiliary did meet. You had 8 members at your last meeting.
Yeah.
Talked about fundraisers.
Yeah.
The upcoming ones for next year.
Yeah, really had, Shoe Roads Productions for sure, and looking at some other things. Probably want to let them. Probably Teresa needs to come on and kind of talk about some of those. But it's good fundraisers for next year. So we'll see some of that.
Very good. And then of course your next meeting will be a holiday lunch out at JB Malone's.
Yeah.
A little different location.
We'll change that up a little bit.
Okay, very good. You guys going to karaoke or anything?
No, I'm not. For sure.
Yeah, just do a little Christmas karaoke. So, oh, Merry Little Christmas.
Yeah.
Anyway, that'll be at noon, and it's a Bring a Friend Day. So those hospital auxiliaries.
Sure.
And you're welcome, even if you are not a member of the hospital auxiliary, come on out on noon of that day in December. Was
December
that 4th?
4th.
Yeah, 4th.
I guess.
Very good. All right, Hospital Foundation. They're going to start selling those. Do you think that's the wrong day?
Well, look.
Yeah, it's not the 2nd. That's Sunday. It looks like the 3rd might be a Monday.
Yeah, we'll look at that.
Oh, my.
I think that's. It's probably
You dropped
right.
that check you're going to give me, right?
Oh.
Is that?
Yeah, I'll look at
It
that.
does look like a
We'll check
check.
into that.
You wrote me a check? That's so nice of you. But it's not mine. All right, very good. Yeah, I think it's December 3rd. Anyway, first Monday in December. Head out to JB's at noontime if you'd like to and be a part of the auxiliary. Find out what's going on. Let's go to the Hospital Foundation. We got Dancing with the Salem Stars coming up January 26th. And, last year it was going to be on like December 5th. So, but because of the City Hall auditorium being kind of tore apart and they're doing different things, not able to hold it there. They had to hold the high school gym. So they had to move it back in between basketball events.
Yes.
Makes it a little bit difficult.
Yeah.
So, anyway, they're going to start this Friday selling table sponsorships.
Yes, table sponsorships. Have more tables this year. So if you want to get down on the main floor, we're starting that. Actually seeing some sponsors that bought tables last year first and then opening it up after that. So
Okay, very good.
We'll be getting some of that information out and probably something here on the radio and
Absolutely.
out.
Time to start.
Facebook, so we'll be watching Facebook because we'll put it out there
And
too.
it'll be on the website as well,
Yeah.
smdh.net. So be kind of just checking that every now and then if you're interested in watching the Dancing with the Salem Stars. Again, mark your calendar, January 26th. That is a Saturday, and it will be the Salem High School gym. All right, very good. They also Chris is gonna be sending out some emails and mailers to sponsors for the golf tournament. I know that's June, and Stan, it's June.
It is.
But you need, for some of the people that do sponsor this, their fiscal year starts January 1st, and they have to plan for that.
They plan it, yeah.
Yeah.
So if we can get our names in now, they can plan that for, they can count us in their annual spending for that. So.
Very good.
Yep.
And of course, still working on still waiting, I guess, on the 1023 to come back for the state tax exemption on filing. It's still waiting. It's government. Takes a while. And then, of course, got a meeting coming up on November 28th. Got a couple new foundation board members.
Yes, we've got Andrew Curley and Andrew Wynn, who's have been confirmed, and we've confirmed, and they're interested. And
I believe Chris Holliday also
and Chris
confirmed.
Holliday.
I think that's what was saying. Very good. All right. Hospital been busy in October. They've been busy a lot. It's good to see Chris get out and about. Like fun. But in October, they were offering 50 free mammograms to people. There was 20. We're going to be 25. I think we're going to be giving away on the 19th, and then one per day for the month of October. I think a total of 30 were given out.
Yes.
Which is great.
Sure.
Wish all 50 could have been given
I
out.
know.
I mean, it just may not work into people's schedules. That's okay. But 150 mammograms, or 190 mammograms, according to this. But he said over 200 have already been done now since it was installed September 1st, which is unbelievable.
I know. It is awesome. Just to think that here in the Salem community that we were just averaging between 15 to 20 every month, and in the last 2.5 months, we're at over 200.
Plus.
So,
and if you have a question about that, call Julie Malone, and don't say, "Well, I can't afford it." There are ways that you can afford it.
Yes.
Or you won't have to pay for it. So find out more about that. Call Julie at 729-6626. Just ask for Julie Malone, and she can give you the details. Even if you get your mammograms done somewhere else, doesn't matter. She can have those records transferred over, and so that
yes,
it becomes right there. Project Rise is a program with Healthy Dent County that is ongoing, and they continue to work on that. They meet every Monday. Didn't meet this last Monday due to some of the weather, but they do meet every Monday. And, of course, Healthy Dent County's casino night. You gangsta.
Yeah, we
were
went gangsta. We did.
You and Chris were all gangstered up with your dollies with you,
Yeah.
Oh, yeah.
Those
absolutely.
dames.
The dames, yeah. I don't want to use this in a wrong
Oh,
sense,
I know.
but the broads you brought with you, right? Isn't that what the old 40s movie say?
Yeah.
The broad. Yeah.
Broad.
Okay. Anyway, well, and then we were doing old Hollywood, so that's why.
Yeah.
Gangsta. But anyway,
It was
very
nice.
Good. It was fun.
It was.
And,
It
hospital
was
helped support
fun
that.
time. Very
Yeah.
fun.
Hospital helped support that and help raise funds for Healthy Dent County. Very good thing. It was, and this is a really nice thing. The Phelps County Regional Medical Center's Dent Clinic, which we know is they're building a new building, and they had Salem Hospital had a chance to host a clinic and provide them with information about the hospital. I think opened up their eyes quite a bit to what you offer.
Yes. No. Anytime we can build a stronger relationship, we want to do that. And so. Had them out, and I know we've had some response since that meeting about asking additional questions, which is great. So, again, when we want to, if we can we want to keep, the community local, and if we can, even working with, in partnership with Phelps Health or the Dent Clinic Phelps Health, whatever.
Why did they change the name?
I think it was a marketing and
well, it's going to be a marketing disaster
to pull all of them together under one name, and they had PCRMC Medical Clinic, PCRMC, all of this. So
but
I will get more information in the coming weeks.
I saw that and I thought, why? And that didn't make a lot of sense. But it's not my call. That's a board decision on their part, isn't it? Hand out candy at Halloween at the hospital in the back, and had a nice crowd because it was kind of a nasty night.
Yeah.
And people liked being under canopies.
Had the overhang.
Yeah. Kind of kept them dry. And then, of course, this Saturday is our Honoring Our Heroes Marathon, and the hospital is going to be a major player in that.
Yes.
You're going to have, obviously, they're going to be wrapping people that morning out in Rolla.
Mm-hmm.
I think
with the sports medicine,
6:30 in the morning, going to be out there. Yeah. So if you if you're a runner and you need to get wrapped, they'll be out there. I'm sure Brittany and Chris and all those guys will be out there. They are going to provide refreshments. They're going to be at the aid stations. They're going to have an ambulance that's going to be coming, following
and
the runners.
Working the crowd.
Right? Yeah. So very, very good. Trees and Trains will be opening up on Sunday with their open house, and then on Monday they'll actually be open to the public, and SMDH is a proud participant in that as well. You'll have I know at least one tree there, if not more.
One tree.
And of course you'll have a float in the Christmas parade on December 1st. Very good. And then still trying to get the weather to cooperate for the sign.
Yes.
I guess the snow didn't help there either.
No. This weather,
Never know.
No spring, no fall, just right from summer to winter. That's what we had.
No, I disagree. We had at least 27 hours of spring. At least.
I don't know about
Yeah,
that.
we did. We had one perfect spring day, but that was it. And then fall days, I don't know if we ever really had a fall. I can't really remember it because it would get hot and get cold. Got cold in September, got warm, then it got hot. Then it, just bounced back and forth. This is Missouri. You can't do that stuff. All right, the chief of staff, I should say the medical staff, and the chief of staff all got together. And on November 12th, and active staff privileges were recommended for Hatim Hamed,
Yes.
the MD.
Yes.
Hatim actually showed up at the meeting.
Yes, he was there to observe. Had some questions. I said, "Why don't you just come and
Exactly.
watch?
You're
I mean,
part
it's
of it.
open to the public, and you can come and watch." And,
Sure. And he's public. Doctors are public.
Sure.
And he showed up. Very good. December board meeting will be moved to a noon meeting on December 11th, which is good because they have a physicians and board dinner that night.
Mm-hmm.
Very good. And then election filing for District 6. That's George Grendel's district. It seems kind of funny that George just got elected here like 2 years ago.
Yes.
Because he replaced somebody. Had to get reelected. Now
Had to
he's
get
got,
reelected.
So that position will come open in April. And you can register for that position starting December 11th through January 15th. If you'd like to. You need to be located in District 6. And if you're saying, where's District 6? I know it's east. But I couldn't tell you exactly.
Oh,
Go to the hospital at
we'll-
the administrative office, and they'll show you where it is.
Yeah.
Very good. All right, new business. You did have one purchase.
Did one purchase. A video tower machine for surgery. So this was a budgeted item. Something. It's not a cheap item. It's a $50,000 item.
Is there anything cheap in the medical
no.
business? Yeah, I don't think so.
No, but after looking at all of our options, we went with a mostly new. There's a few parts on this machine that was refurbished, and it was all with Olympus Corporation of America. We had some other bids from Olympus and Unitas. It's a company that combines the two together and
Work together.
Yeah, they work together and provide different parts. We decided to go all one machine from one vendor. It's just easier, and there's no complication of
No finger
is
pointing?
it this or what is it?
It's their stuff.
And it's all taken care of by one vendor, and so it's kind of the direction we went. 66,000, so over budget, but definitely getting a good machine. So they voted on that, and we
Improved that
it.
one. Very good. And basically that was it. You went to closed session. Anything voted on?
We did. We were asked by the city. They're in the middle of their sewage extension or and then somewhat water extension too.
Wastewater treatment and sewer extension.
And the sewer extension, wastewater treatment, all of that. And so they were in the middle of that and had asked about a community member that wanted to, if you remember, our line that feeds the hospital has been a dedicated line for a long time.
Before I came here.
So that dedicated line and asked about
Tapping into it?
Tapping into that for an individual. The board voted no, and so there was a no vote on that. We did come back after a little bit more discussion and say, well, let's find out a little more information on just the whole process and some of the timeline, because depending on that timeline, they may want to revisit that. So we said okay, and they all voted to bring back information and come back and have me bring back some information. So I'm going to go forward.
So you voted no, but then
Yes.
you reconsidered and you're open to it. So you didn't really make a final decision.
Yeah, right.
Kinda did, but
we
kinda
voted,
didn't.
so I wanted to make sure we
Right,
disclosed
but
that.
you did
And
vote it,
yeah.
But so it's still
It's still
still a
open.
no for right now until you get more
Yes.
information.
Yes.
Okay.
So
Because the hospital cannot be without water.
right. Right.
That's,
And any interruption there is very concerning. And so if there was a way to do that without interruption, but I think between that and just in general, what else?
Is that a 4-inch line that goes out to you guys? Do you know?
I'm wanting to
Or
say
6?
that it's 6.
Okay.
It's 6. And I think they're bringing and tapping into it with either a 6 or a 8 eventually, because they're going to create a loop. And so they will tap into it closer to the hospital.
The loop was to make sure the water would get to the hospital either way.
Yes.
So if something happened out on one track, the other side would, okay.
And so, if we're going to, again, the day that, if there's tapping in, you kind of want to tap in once and
not. You don't want to be shut off very long, do you? So you got to shut off.
And it's going to have to be a convenient time and so.
Yeah.
It seems like whatever happens, whenever there's any interruption, I mean, they can flush the lines for, a fire hydrant or something like that, and there's not interruption, but whether it's sediment or whatever that comes up in.
Right, it's not the same pressure either.
No.
Very good. All right. Well, very good. And that was the hospital board of directors meeting from Tuesday and the audit, which we talked a little more than they did. So that's okay.
Yeah.
That's all right. But it's well worth it to go over those great details. Another outstanding year for our hospital, and how important that hospital is to our community, and we really appreciate it. I really wanted to thank not only Kasey, but Chris and everybody there that does a tremendous job. You mentioned Monica and Ashley, and like I said, we got a whole bevy of great people that do a tremendous job, and we could probably sit here and name them all off, but we had to be here for a while. But there's quite a few employees, which makes it interesting. And and if you're interested in working at the hospital, you guys do post-job positions on your website.
On the website. Mm-hmm.
So you can go on there, and it's smdh.net if you are looking for a position. And if you want to be a coder, boy, you got to have a great memory and fast fingers. I tell you what, but accurate fast fingers, not like my fast fingers, which type hieroglyphics, I think is sometimes. But I looked at that word and I said, "What did I spell there?" I don't know. Can't read it. Looks like Russian. Yeah. But anyway, again, I want to thank Kasey for coming in. Thank you, sir. Appreciate that, and coming in on probably not the most pleasant morning, but we got bright sunshine now.
Yeah, now it's going to be beautiful out there.
Yeah, it's going to get nice and warm, and all it's going to start melting off. Very good. But again, thanks for coming in.
Well, thank you.
And I want to take the time right now to wish you and yours a happy Thanksgiving.
All right.
And we'll be seeing you again on December 11th. At noon at the next board meeting. And again, those board meetings are open to the public. You are welcome to attend and get to hear what actually goes on at the SMDH board meetings. And many times, like this hospital audit, that would have been a really good time to show and find out and hear from outside sources.
Yes.
Not from inside sources.
Yes.
Inside sources always can make it sound good, even when things aren't good.
Yes.
Outside sources don't lie.
Got to have that independent voice.
Well, I mean, I was at the audits a few years back when they weren't so good.
Yes.
And that's what the auditors told them. It's not so good. Things, you need to do this, you need to do this. And they had lots of recommendations, and a lot of those recommendations were followed and or implemented, or I might even say used as a springboard into something different. It may not have done exactly what they said, but based upon what they said, knew something had to be done there and made an adjustment in that way. So, but it's what fits your hospital. I mean, auditors will come in and say, this is what others have done. That may not fit Salem, what others have done. Just doesn't work that way.
But and you mentioned it before, and it's, the swipe of a pen, changes that happen, regulatory policy or regulatory reporting, regulatory changes have a lot to do with the well-being of the hospital. And so, we will be reaching out and saying, hey, help us to, plead our case, our position with the legislators and government. So need all the help we can. We want this hospital to be here. It is a
long time.
Yeah, it is very important that this hospital be here to provide the care that we all need. So
yesterday I was saying, and I used to get lost at the Salem Hospital until I went to Mercy. Oh Lord Almighty! They have built building to add to building to add to building, and you go down the hallway, and the next thing you know, you started out on the east side, you're at the south side, and you have no idea how you got there. too many hallways that are unmarked, or they're marked one way. Cafeteria this way, but they don't tell you how to get back.
Yeah, no.
And my brother got lost. He goes, I ended up in an attorney ward. I said, are you expecting? He didn't like that. But anyway, I'll have sense of humor. But they guided him back to where he needed to go. So, very good.
Good deal.
But anyway, how important our hospitals are to our health. Also, while we just have just a real quick second, don't forget your flu shots. I talked to Ms. Haynes.
Yes.
Kathy Haynes. And
Yes.
she says, knock on wood, but as of right now, that Salem has not had any cases of flu yet reported. Let's keep it that way. Get that flu shot and be healthy for the holidays. Please stay that way. As we know, last year at Christmas time, we had an influx. That was not very pretty. So let's stay healthy, okay? Very good. Kasey, again, have a happy Thanksgiving. You and Hope have a great time, and the rest of the family and everybody at the hospital have a very good, happy,
Thank you,
safe.
Stan, and you and Sharon,
Thanksgiving.
too. Thank you.
Here, KSMO Radio 1340. Stick around. Our Civic Record is coming up next.
When you need your oil changed in a hurry, stop in at Knight Auto Care's fast lube at 307 Highway 3272 East here in Salem. Their full-service oil changes include up to